Hi, good afternoon, and welcome to the COVID-19 webinar by Tryon Medical Partners. This is the April 2nd session, which will be recorded and posted on the Tryon Direct website. I'm Patrick Brady, Senior Vice President at Tryon Direct, and I'm responsible for business outreach. We have attendees from across the state, and some of you have participated in our past events, and we want to welcome everybody today. The event that we're holding today is very different than any that we've had previously. This will be a call to action for you as business leaders, and it will be a very transparent discussion on what faces us in the critical days and weeks ahead. We highly encourage you to ask questions throughout the hour, either by chat or by hitting *6 on your phone. Through our COVID-19 task force, which is made up of medical, business, employer, and financial expertise, we have two ways that we want to support you. One is through this webinar, which is held on Tuesdays and Thursdays from 4:30 to 5:30. And two, through our task force, which can be reached at tryondirect.com, that's TRYON direct.com. The agenda for today, as you see on your screen if you're on the webinar, includes COVID-19 urgent action needed from Dr. Dale Owen, our CEO at Tryon Medical Partners and a practicing cardiologist. And you'll see the expected acceleration of cases in Charlotte will be topic 1, the steps that need to be taken now. Topic 2, ensuring the healthcare system can care for patients. Topic 3, and then at the end, we will wrap up with a brief update on the task force, how you can interact with us through our website. Again, let me reiterate, we want to get your feedback and questions as we go along this hour. We will also have time at the end, so it will be roughly 30 to 40 minutes of hearing from Dale. And then we will have time for questions, but don't hold them. Let us know either through the chat or by phone. Also on the phone, we have Gaston Gage, our Chief Strategy Officer at Tryon Medical Partners. And after today, we will post the audio and slides to the Tryon Direct website tomorrow, April the 3rd. With that, I will turn it over to Dr. Dale Owen.
Hi, Patrick, can you hear me?
Yes, we can.
Okay, good. I just wanted to make sure that the mute button wasn't working properly. So hello, everyone. I'm Dale Owen. I'm the CEO for Tryon Medical Partners. And we do want to have a different type of meeting today, more of an information, informative type of meeting and interactive with as many questions as you wish to ask. I think that everybody has gathered that over a period of time, what we've been talking about has come to fruition. Nobody, I don't think, really wanted to believe this back in February and March, in the first weeks of March and so forth, that this was going to be such a significant problem for the United States, for the Southeast, for North Carolina, and for where I'm talking from here in Mecklenburg County in Charlotte. There are tremendous hotspots around the world. The United States has now clearly become the single country with the single most cases reported. I think if we were to really go back and look at those cases, it's still a significant underreporting. We're still testing probably what used to be maybe the top 20% of the cases that were the sickest. We've had more testing available now, and that's helped some. But now the CDC has actually come out and talked about not testing people with minor disease and minor symptoms because there weren't enough tests for those situations. So again, we're going to be testing the sickest of the sick again. It's being pushed back towards that group. I would say that when we look at the reporting of cases, there's a significant delay, and we've talked about that in the past. So 236,000 cases now reported in the United States today. It's about a 40% increase from yesterday. 1,900 cases with more than 20 deaths in North Carolina now. We're 19th in the country. We were in the low 20s. We are being paced pretty closely with other groups in that top 15, but we're catching them, unfortunately. And maybe by the end of the week, we may be close to the top 15. It's hard to say, but given that we have a significant metropolitan center and three major airports in the area, that does not bode well for how this virus progresses. So you may see on this first, let's see, there's the agenda slide, then the testing slide, and then the next one, the third slide, is the exponential curve in the United States. So here we are, essentially April 1st and 2nd now, and we are, as you can see, still on that exponential rise. This is not linear. It's not 1 to 1 or 1 to 2. This is for every individual that gets COVID, they pass it on to 3 more people, and each of them 3 more people, and each of them 3 more people. And after the third pass, 1 person equals 27 people. And that's the classic exponential curve that you see here and why this virus has become so dangerous. Death rates in the United States have been in the 1.4% range. They're increasing. They'll be increasing because of the severity of the people we'll be testing. And I will tell you, at our satellite clinics where we're testing patients ourselves, the patient's degree of illness has become much more significant. They are presenting with much more advanced cases. We sent 2 to the emergency room yesterday with oxygen saturations that should be in the 98 plus, and they were in the mid 70s and are still in the hospital. I think we all have seen this affect us in some way, shape, or form. If not, you're very fortunate at this time. So if you look at the next slide, the coronavirus case trajectories, you can see in the background cases doubling every day, every 2 days, every 3 days, every 5 days, every 10, and we're in somewhere between every 2 and every 3 days, still at an exponential curve and rate of increase. I want to go back to the second slide and the coronavirus testing options. There's a lot of misunderstanding and gamesmanship being played by different testing companies trying to promote their testing rather than doing what's right. And we have 3 major groups of tests. One is the PCR test, the antigen test, and the antibody test. And I won't go into phenomenal detail on this, but to explain to you that the PCR testing that we do and that some hospitals do is by far and away the superior test, especially to find the people at early stages. As a matter of fact, from 0 to 5 days, it is the only test that can find these folks in asymptomatic cases or situations. The more common antigen test run by many of the major labs and such doesn't become positive until after the 6th day when patients are already symptomatic. So we are behind the 8 ball by at least 6 days just by that kind of test alone. And then we're having to wait 4 to 10 more days for the test to come back. So we are looking today we're looking retrospectively at things that happened 9 to 14 days ago. that's how many cases we really had at that time. And if we have 236,000 cases now, you know we have more likely close to 10x of that, somewhere in the 2 to 2.5 million total cases within the entire United States at this point. There are some that would disagree with that and say it may be 1.5 million cases. Okay, same message. It's gotten out of control. We're here to tell you the truth. I think it's important that everybody understand this. We've been talking about what to do for weeks, and in all honesty, our government at the federal level has been slow to act. Our government at the state level has been somewhat slow to act, and I think there's been too much of taking a poll as to what's the right thing to do rather than leading. And as a result, we're going to pay a price for this. And the price is number of people getting ill, and the deaths are going to increase across the United States because of it. That's just plain fact. We
Dale,
could have.
Can I
Yes.
can I interject for a minute? We got a public health question that's come up. I was going to let you finish that slide. So for employees still working at essential business, what is your recommendation for wearing a mask? It seems Dr. Fauci has made comments about the benefits of wearing a mask in public.
Okay, so first of all, to know what to wear or not wear, you have to understand how it's spread. And the data that's come back recently that's even more helpful at telling us. Initially, we thought that this was a minor respiratory spread, heavy droplet, lots of contact on surfaces that was causing the problem. We now know that there is a fecal oral route with people going to the bathroom and not washing appropriately and so forth and leaving germs on door handles and, you know, toilet seats and everywhere else. We also know that the respiratory droplet is a lot more aerosolized than we thought. It is staying airborne for minutes at a time, if not longer. And the distance of 6 feet might not even be enough. So what to do is based on contact and breathing something in or the air. So face mask is important and gloves are important. Here's the problem. There aren't enough. And the people who need them the most are going to be in hospitals. We literally, in our medical offices, are rationing face masks as we speak. Now, we also have UV light boxes that are supposed to kill the virus that we put these face masks in so they can be reused, things of that nature. So they should be okay, but there's just not enough protective equipment to go around. However, if you have access to it, it's a face mask and it's gloves. And it's stay inside. I mean, I shouldn't say inside. Stay at home. And this social distancing, I heard somebody talk about it recently, probably a misnomer. It should be physical distancing. Staying away from other people, staying with your family. Hopefully none of them are sick. If they are, you've got to isolate them from the rest of the family. I think it's really important that companies understand that what is or isn't really essential becomes very important. If it's essential for the infrastructure of the functioning of the country and of the city and so forth, then that's truly essential. And those companies should continue operating the best they can. But if it's not, then we would urge you to immediately get as many people home as you possibly can and to essentially create self-quarantine and follow the governor's guidelines of stay-at-home policy. Nobody likes that from a financial standpoint. Nobody likes it from a mental health standpoint. But we are the food for this virus, and we have to starve the virus. And having people out in the public and in large companies with large people around each other and coughing and touching things and so forth is going to create havoc and make it even harder to get through this.
Dale, follow up to that. Are the face masks that people are making at home, whether they're cotton or some other material, are they effective?
Face masks of any kind are at least somewhat protective. The N95s are the best because of the size of particle they allow, but I'll tell you, I've worn them on airplanes and so forth, and they're not the easiest to breathe through. But a face shield could still breathe in something from above the shield. A face mask that covers your nose and mouth is much better. And you can pinch the nose better and tighten it up and so forth like that. But those, the ones that are self-made and so forth, they have some help, but they're not as effective. But they're better than nothing.
All right, this is good. We got another follow-up, same line of question. Do you recommend wiping down all things purchased, received through the mail, at grocery stores with a disinfecting wipe, washing your hands after handling food items and packages, is that sufficient?
So the answer to that is, if you didn't see it come to you, then you don't know what it has on it. It's that simple. So I'll give you a great idea. Yesterday, we received a package from New York City, and somebody looked at it, and we all immediately froze, and everybody wiped it down. The place that the courier touched, wiped it down, wiped down the package itself, opened it, and wiped down the contents from inside before anything was opened up. So the answer to that, unfortunately, is yes. Some people are scared about the food supply and, touching things on the food. Wherever possible, wipe down. Peeled things, things inside of a peel are obviously better, things of that nature. And yes, you go to Costco and they've already wiped down all of the handles for everything you touch on the buggies you carry around, the carts. So yes, I think it's important that you wipe down. It's essentially covering your tracks, as if you had glow in the dark ability where everything you touched, all those things that would light up would be the things you need to keep wiped down. Door handles and the flush for toilets and for sinks, the knobs and the spigot itself are all issues as well. So a lot of people will finish washing their hands and then turn things off with the knobs. Don't do it that way. Wash your hands, get your towel, dry your hands, use the towel to turn those things off, wipe them, and throw the thing away. That's how you protect yourself.
Dale, I may
Anything
have
else?
a question on the phone. Let me stop for just a second. Is somebody trying to ask a question from the phone? Please jump in if you are. Okay, keep going.
All right. So I think it's important that with these tests that we not get complacent in thinking that, well, I'm staying at home, therefore no way that I've got it, all of these things. I think also the public, a good bit of the public is still not believing what's going on out there. And it's been mixed messaging at the government level that I think has created a good bit of this. It doesn't matter what people say, it matters what the virus is doing and what is real. What are the facts? What's the data? Not what somebody wants it to be, not what somebody wants the country to feel better about. And that's unfortunately created some misconception. You know, we still have neighbors, you know, with 10 boys playing basketball together, and, you know, wasn't appreciated when we came over and had a conversation about it. They don't believe in it. Well, it's real, folks. And what we anticipate is that I would have said maybe it was going to be 2 weeks from now. I think it's maybe going to be 2.5 to 3 weeks from now. It should be like midway to the end of the week after Easter that we're going to start to see the big peak in cases here in the state of North Carolina. We're a little bit behind some other states, which is great, which means that the social distancing quote has more of an effect locally if we adhere to it and the stay-at-home policies. But this curve, because it took so long for people to act, to do something about it, and create these stay-at-home policies, this curve is going to last longer than 4/29. That, I don't know where that comes from other than somebody wants it to be that way, but there's no modeling out there that says that 4/29 is going to solve this issue. Nobody wants to hear this, but it's really true. The modeling looks like it's a minimum of 8 weeks. We're looking at 6/1 to hopefully have gone past the top of this curve and be heading down. We hope it's then. That's what looks like it's real. Happy to take any comments or questions or anything about that point. I think that one of the things that has come out with all the stimulus package is to be very realistic about the fact that this first stimulus package, and I say first because I mean first, is that's not all that's coming. That will help for a month to 6-8 weeks at most, but it won't help people get back on their feet financially afterwards. So I expect there to be more coming on the back end of this or during it, so that there's not such a drop off and a slow upstart of the economy after we've handled this virus. It will remain critical that after we see this curve start to blunt and turn down, that we not go back to old habits. We need the growth rate to be 0 of new cases, and when it's 0, add 14 days. Because that means that everybody's gone through it and would have been symptomatic by then, and none of those 5 and 10% outliers are left to be seen. That's what's important. So, happy to take any comments or questions about that. Speaking with the hospitals, they're anticipating their modeling is also at 2 to 3 weeks. Peak here in Charlotte might be a couple of days or a week after that in Raleigh and Durham area and Winston-Salem. Maybe a week later than that in Asheville. We have 2 large hospital systems here in Mecklenburg County, and both are seeing it the same way and coordinating care with each other. But I've already been on phone calls with them, and even Monday, offering to our help in whatever we can, because they're going to get a big deluge of cases that come in, and they're going to have to bump out a lot of patients out of the hospital that they normally would have kept for another 3 to 5 days, and have to put those back on the outpatient doctor so they can take care of the critically ill.
Dale?
We anticipate, yeah.
Sorry, we got a few questions. I'll let you finish real quick, but we got 3 questions to jump in on.
So I'll do that just a quick second. So the hospitals are anticipating being not having adequate enough ventilators within several weeks of the peak, because the peak's going to be sustained, and those people frequently are ventilated for weeks at a time. There was a patient yesterday that was sent back out of ours that was still requiring oxygen, but was well enough to be able to go home. That's going to be the minor cases we see come out. There are going to be people coming out who initially went in on 6 liters of oxygen, and they're going to be coming out on 3 because they've potentially turned the corner, and we'll be seeing them on a daily basis. So that's what we anticipate. They're already creating contingency plans to take over unused space in the city and the ambulatory surgery centers for both the normal patients in the hospital, not the COVID patients, and others for a contingency for COVID as well. So that's what we anticipate. That's what we've seen in New York. We've seen it in New Orleans. We're seeing it in Chicago. They took over the McCormick Center in Chicago. They got the ships in other places in New York City. Superdome is looking like it's going to be retrofitted in New Orleans. And we're going to be doing the same thing here. Go ahead.
Let's go one step further on that if we could, because I think this is a really good practical point to speak to you as business leaders out there. You know, what happens at that point? So the beds, the ventilators, they start to run short. What does that mean for hospital releasing patients? What is a primary care practice like Tryon prepared to do when that spillover happens?
Well, essentially, the hospital systems are creating what is a disaster plan, right? But it's not a disaster plan like an airplane crash or a tornado or a hurricane that comes through and leaves, or it's a one-time incident. This is like every single day for 30 to 60 days. It's like having multiple airplanes crashing per day for 30 to 60 days in the type of response they have to be prepared for and the level of coordination that they're getting prepared for. We anticipate as primary care physicians that we're going to be seeing much greater acute patients being sent out of the hospitals. This is why it's so important that before it happens, that our regular patients are so well cared for with their chronic conditions that there's no way that they could possibly have to go to the hospital. And that, if not, that really creates a massive burden on the hospitals and overburdens what is already almost impossible to deal with. So the number of ventilators, they could double or triple them, and it might not be enough in the entire city.
And so in the short term, practical advice for this group, what do you do to prepare? What do you do to prepare your workforce? What are some of the practical steps that people need to take right now, Dale, in terms of having a physician relationship, understanding the risks that they face? What would your advice be?
My first advice would be for everybody to get really serious about the stay-at-home policy. I think that's critical. And if we don't do it, we're going to pay a big price. Everyone is. And how long it lasts, lives, financial, everything. The next thing I think is that all of your family, friends, and employees that have chronic medical conditions need to make sure that they are in the face of their primary care doctors making certain that they are up to date on everything, have all their medicines refilled ahead of time, because they're not going to want to go out and run risk of various things. So I think that's a critical piece that we've sent out in emails and so forth to all of our patients, is for all of our chronically ill patients to make contact now so that we can get ahead of this and they're not trying to reach us in the middle of this storm that's coming in 3 weeks. Then for the people who are obviously less ill, is to make sure that they're all taking this process seriously and preparing their families and homes for a long haul. But it's something we'll certainly conquer. It's something, you know, we're tough as nails in this country and in this city and state, and we'll survive this with great aplomb. However, it's not going to be easy or fun, and we just have to knuckle down and do what we know we have to do to solve the problem.
Dale, I want to give you just a minute of pause. You might need to get a bit of water. Let me check on the phone lines here. Is there anybody? We've got about 4 questions in the chat, so we'll hit those in just a minute. Does anybody on the phone have a question that you want to get in, and I'll put it down with the rest of these? Not seeing any. Okay.
Go ahead.
All right. First question, can you address the herd immunity that has been talked about?
Sure. So what is herd immunity? First of all, it just means that the herd, or the cattle, the horses, or the people, in this case, develop an immunity to a particular type of virus or bacteria or what have you. So if you go back to that slide on the testing options, I can explain it this way. The purplish looking hump that you see starting at about day 12, peaking at day 22 and dropping off at day 30 is an antibody response, or part of our immunity that is developed. This is the first antibody that we developed to the particles on the outside of the virus. Notice it doesn't start until 12 days, so it's not a good test for an acute infection because it happened 12 days ago. But notice it's gone by day 30. That's not long-term immunity. The next sort of yellow line that's straight at maybe an angle of 20 to 30 degrees there is the IgG antibody. That is the antibody that we measure to determine immunity, long-term immunity, so that the body's ready to attack and fight something with its memory of antibodies that it has, called the IgG antibodies. Here's the problem. This is a new virus, and we don't know how long this IgG antibody is going to last. We've never seen it before. That's why it's so critical that all the patients who have had COVID-19, coronavirus, that they get into research studies like crazy afterwards, because we need to measure immune response to know whether or not this antibody is protective later, or if we're susceptible to another onslaught. I hope that helps.
Yes, thank you for that. Next question is multi-part, Dale, so let me tee this up for you. Testing, Kendall, can you go back to the international graph? Or forward, thank you. So testing, it seems that Germany has kept the numbers lower by early and broad testing. Dale, you can comment on whether that's truly the case. Can we locally push to model that with asymptomatic testing? Are there tests available, volume available to make that happen? And in other words, can you invert the process, test those not showing symptoms, who can then be isolated if positive?
Well, that's a very interesting question. I think everybody wants to know that. So let me first of all say that just in the United States alone, let's say there's 300 million people, we would anticipate that several million have already been infected. We don't have that number of tests to even be able to perform at this point. That's been one of our major weaknesses in this, is that we've been fighting a battle that happened, 5 to 10 days previously, and we don't know who really has it. The only test right now that can test and capture asymptomatic patients are the PCR tests, and they're a nasal swab and so forth or throat swab that then is analyzing genetic material inside the virus, because the virus is broken down in this assay and so forth. And that's the only test that can really help us identify things at an early stage. Now, there's a new PCR test that's come out. I'm sure some of you have read about it, from Abbott Labs. Currently, most PCR testings, even by hospitals, are taking a minimum of 10 hours, if not longer. But the PCR testing from Abbott Labs can be 5 minutes for a positive test, may take as much as 13 to 15 minutes for a negative test to declare itself. That being said, 50,000 testing, either kits or what have you, were to be made and sent out this week by Abbott Labs. We needed those a month or two ago. Right now, they're sending them to all the hotspot areas, but let's think about that. A hotspot area is someplace where if a patient comes in and has classic symptoms, they probably got a 99% chance of having what we think they have. So using the test on that person is not really very helpful. But in the areas where the density is less and the number of patients positive is less, that's where knowing more about the testing becomes critical, because then we have the ability to isolate better, if that makes sense. So if you have one person, you isolate it to prevent it from coming 3. But in New York, that one has already become 2,700, and they're spreading it to 3 more and 3 more and 3 more, that it really doesn't matter much anymore about that kind of testing, unless you have a test that can test everybody in the nation, which we don't have. So I hope that answers the question, in that each country is testing in a different way or manner, or who they're testing, and so forth. And what the NIH and others have agreed upon now is that unless there's an infrastructure critical need to know about asymptomatic patients, these patients for testing should all have more than mild symptoms. So that automatically eliminates probably 75 to 80% of all the people who have it. So you're never going to get the curves to look right when we're not testing properly. You'll always have statistical bias one way or another in that situation.
Thank you, Dale. I'm going to give you another break, and I'm going to take the next question. So this one is on the stimulus package. The loan to small business starts tomorrow. Any advice or guidelines? Main points. We do typically have Granger Pierce, a labor attorney, on with us. We do not today because of what we wanted to devote our time to, but here's what I can tell you. There is one of the best documents that we've seen to come out is from the U.S. Chamber of Commerce, and it goes through a very clear, succinct way of thinking about that. So questions you may have: am I eligible? What will lenders look for? How much can I borrow? and will the loan be forgiven? So let us send that out to you at the end of the call today so that you have it. I think that's very important. And as you said, this is getting ready to go into effect tomorrow. Dale, next question is back to you. What do I do if I need to see my doctor for something other than COVID? Should I go into the office? How should I connect with them?
Well, I would call and ask what their protocol is. So here's why I say that. At Tryon, what we did was realize that patients are going to come in based on their perception of what's going on, not necessarily what we as physicians think is happening, but what the patient's perception is. And if they perceive that the medical offices are places where sick people are sitting in waiting rooms, wearing masks and so forth, there is no way in hell that these otherwise well patients are coming in. No way. So that's why we created the satellite testing clinics and have all of our patients. We reached out an email to every single patient of ours and said, if you're ill and you have a fever, we don't want you in our offices. We will triage you through your physician and potentially either do a virtual visit, or we will send you to the testing clinic where you will have an actual physician examine you, or a nurse practitioner examine you, do a fully appropriate exam, and then decide whether or not you need X, Y, or Z type of testing. So I think that what's important is, what has your physician's office done to eliminate and reduce your risk? If the patients are still in there and they're sick and coughing, turn around and get out. They need to create safe zones for their patients who are not actively and acutely ill. That's the important thing. I would call first and make sure your physicians are handling it in that manner.
Okay, next question, Dale. So the patient infection rate by age group, can you reiterate to those on the call what we're seeing? Is it simply a feature of people that are older that are getting it at higher rates? We've got a slide going up right now for folks to see. Can you comment on this? Because you have in the past said, listen, this isn't just a middle-aged and elderly problem. Younger people are getting this as well. Is that still the case?
Yes, even infants are getting this. It was a very unfortunate propaganda, I guess maybe some way, that's not the right word. It's a very unfortunate amount of news that came out that this was, just in the old folks, all the young folks, don't worry. I think that's why you saw so many of them out at spring break on the beaches in Florida and everywhere else. They just became the petri dishes to bring it back to everybody. It created a false sense of security for people under the age of 50. But if you look at the COVID patients by age in North Carolina, and it's pretty close to what we're seeing across the nation. 50% above age 50, 50% below age 50. 50, 50, 50. Deaths, however, as you might imagine, the people who are more likely to be ill or have other problems, more of them tend to be over age 50, so you tend to see more deaths in that age group. But the folks who have illnesses under age 50 that know about them are at significant risk. The patients with diabetes, severe high blood pressure, heart artery disease, weakened heart muscles, immune system abnormalities like the rheumatologic diseases, lupus, rheumatoid arthritis, psoriatic arthritis, all these things.
And is there any...
That's the key.
Here's a secondary part to that thought, Dale. Is the severity So we see cases where the severity just increased so fast in people. How much of that is tied to existing medical conditions? And is there anything that you'd want to share with this group about that severity?
We've seen severity increase rapidly. We've seen an insidious onset of it, very slow. We've seen, if you can think of it, we've seen it. There's no absolute rule of thumb, except that the patients who are getting short of breath and have a heart rate that's increasing are the big deals. Those are the big two discerning points. The level of temperature is not the issue. We have people who are deathly ill with temperatures of 100 and people who are walking and talking with a temperature of 104 and everything in between. So to me, the biggest hallmarks are not the temperature, but the heart rate and the what was I saying? The heart rate and the breathing. So a lot of people have a pulse oximeter at home or buy one. Their heart is the devil to find right now. But a lot of people are sending patients home from hospitals and so forth with pulse oximeters and such, and those are quite helpful in determining when people are starting to worsen.
Part of the reason for the urgency today, and Dale mentioned it in the beginning, I want him to come back to this so everybody has a chance to hear it again, is that as a region, we're not yet a hotspot. Dale, talk about the timing of when that changes. Are there other areas of country that aren't hotspots? When do we expect the map to look drastically different?
Well, you've already seen some of the hotspots develop, and clearly New York is one of them. Chicago, New Orleans, San Francisco, Los Angeles is becoming one. Atlanta's not too far behind. North Carolina itself is number 19 in total cases. That may or may not be real or not. It might be higher, we don't know. Our density of population or lack of density of population is going to help us somewhat versus, you put 500,000 people in high rises over about 25 city blocks versus the same number of people over the whole city of Charlotte, and you get more distancing that way. So the concentration has a lot to do with where the hotspots are going to develop. But it's eventually going to get to Charlotte by the stay-at-home order coming as it did, thank goodness. I think it was last Friday. That should help us delay becoming one of the big hotspots, but it will eventually happen, hopefully not as high as it would have been had we not done a stay-at-home order. But it is coming, and we just hope not as severe, and it's going to be in the next 3 weeks. I'm hoping if everybody really takes it seriously that we may not see the peak for 3.5 weeks or so, and it'll be an even smaller peak. But it's gonna take all of us working together to make this happen.
Okay, thank you for that. The next question, and this comes up quite a bit. I know our doctors have spoken about it publicly. Talk about the steroids, the anti-inflammatory, ibuprofen versus Tylenol. What advice would you give?
Sure, the initial things on anti-inflammatories was not based on studies, but anecdotal, just anecdotally looking at cases and getting a general gestalt of things. But that might be in one place and then 14 others disagree. So the whole thing about Tylenol and anti-inflammatories has all been debunked. There's no issue that we see with anti-inflammatories versus Tylenol for the good or the detriment of the patient. Steroids is another matter. Steroids is a real problem. We we don't want to give steroids to patients who have this problem. It has not been helpful. As a matter of fact, there are trends, not proven by long-term data, obviously, but there are trends that suggest that steroids are actually harmful. And that's obviously intravenous steroids, injected steroids, inhaled steroids, all of these things. So that's what we see so far.
Okay, great. Thank you for that. We are a few minutes before closing up the hour, and I'm going to stop here, check the board. I do not see any questions, but please get your questions in the chat. I'm going to be quiet here for a second and let anybody on the phone that wants to jump in, please do that now.
All right, Patrick. Can I end with this?
Yeah, you wrap up from your end. I got a couple housekeeping items and then we can be done.
Nobody wanted this. Nobody likes it. Nobody's enjoying it. It's a nightmare from a physical, health, financial, psychological standpoint, but it's not something that we can't beat. The only way to beat it, however, is to lock arms and do it all the same way. And gently or otherwise get everybody you know to stay at home and practice this physical/social distancing. It is the key. We have to starve the virus. I would also ask that you reach out to your physicians. If you have any kind of health issues of significance, make sure you get all of your prescriptions updated. Make sure you've had an opportunity to talk to them by virtual visit or in person before this peak hits. They are going to be overwhelmed afterwards. We'll still be available, but we're not going to be as able to answer things as quickly as we would normally like to. So we don't want any patients getting under the gun because about to run out of medications and so forth. Be very proactive. Everybody in your companies, tell them to be very proactive and get all of their refills in hand. This is going to be a bit of a long haul. It's going to be in the 2 to 3 month time frame, not the 1 month time frame.
Yeah, we do
But
have.
we will come at it on the other end.
Okay, sorry, bad timing on my part. We do have one question that came in the chat. Can you visit people if they've been social distancing for 14 days? Is it safe?
No. No, it's not. Because if they've been social distancing, you know, it's very tempting for everybody to say, well, they know that X person, you know, Bobby Sue is over at their house and they haven't done anything and they've been exactly doing the right thing. But I'm betting you they've been to the grocery store. I'm betting you that they've filled their car up with gas. I'm betting you that they've been out in public in some way, shape, or form. And I haven't seen anybody being perfect yet at this, not only the social distancing part, but the wiping down of things and so forth. So it is an assumption that somebody would be making that they are protected, and you know what happens when we assume.
Thank you, Dale. We asked Dale to carry the hour today. And Dale, we really appreciate that. There was a lot to cover. And I want to wrap with just a couple items, and we'll be done on time here. On the Tryon Direct website, if you're on the webinar, you can see the spelling TRYON Direct. Kendall, if you'll, okay, Kendall's showing the landing page. What I wanted to say about the website is we are getting these type of questions outside the webinar as well. And what we're trying to do, because our doctors are being interviewed in the media literally Dale, every day, every other day. And we're trying to push that out to the Tryon Direct website. We think it's timely. Those are short, consumable messages, usually a minute to 2 minutes. And that's something that we will house where you can go sort of as a repository to see that. The last thing I'll mention to you is there will be a post-webinar survey that we will send out by tomorrow, likely tomorrow, and that will shape our future webinars. Today was about urgency and timing, if you take nothing else away from this content. And Dale did a fabulous job of walking us through what that means. But future webinars, we are here to support this dialogue. And we're going to send this survey out for those of you that have been on the webinar. Please give it a few minutes. Take the survey. Tell us what you find most valuable, least valuable. We will tweak the message to make sure it's fresh and timely for you. And with that, we are done a few minutes early. I want to thank everybody for your time, and you have a good rest of your afternoon.